Thank you, everyone, for joining us today. We have a wonderful pediatric and neonatology team from Vineet Gupta. And you're joining all of us for an enlightening session on holistic approach in pediatrics and neonatology, where leading experts from Vineet Gupta Women and Children's Hospital and M42 will explore the groundbreaking advancements in pediatrics and neonatal care. This session will delve into some very interesting and fascinating topics such as advanced immunotherapy in revolutionizing type 1 diabetes mellitus. In UAE, the benefits of multidisciplinary approach in certain chronic respiratory and neurological conditions in children, and the latest advancements in prematurity and neonatal care at the NAT state-of-the-art NICU. So let's start from you, Dr. Abdulla Al Junaibi. You are the head of the Department of Pediatrics, and you are a pediatric endocrinologist. So can you tell us something about advanced immunotherapy, which is first of a kind in UAE and the region, and how it is revolutionizing the treatment of type 1 diabetes patient, which is a very, in general, debilitating and concerning condition for young children. So can you tell us more about that and what we are doing in the Vineet Gupta for advancement of that? Thank you.
Thank you, Rajwana. So just let me give the audience introduction about what mean of diabetes. So as you know, diabetes is mean high blood sugar. In pediatric and children cases, the majority of the cases that we see is type 1 diabetes. This means that the body, for a reason that we don't know, start attacking the pancreas and attack the beta cell that secrete the insulin. So these kids, unfortunately, they have absolute deficiency of insulin, and therefore they are dependent on insulin therapy for their lifelong. Since 1921, after the discovery of insulin in Toronto, insulin is the only treatment that we use so far for management children with type 1 diabetes and as well adult. Over the last many years, there has been an increased advance in the management of type 1 diabetes in both arms. One arm is using the technology in terms of delivering the insulin. So we have many type of insulin that work for a few hours, for longer hours. And different method of delivery of the insulin through pens and insulin pump. And as well, partner with that, the technology has increased in the monitoring of the blood sugar for these children and adults. So this is the R number one. R number two, which is the more advanced we hear about, is using the immune therapy. Because we know that type 1 diabetes is an autoimmune condition. And the immune therapy is a way of remodeling this complex disease. So there has been a lot of studies and clinical trials in this aspect, but luckily in 2022, the FDA announced the first treatment and therapy in modulating the immune response, and they call it the teplizumab, T0. So after extensive clinical trials and research, they came with this approval, and that has been shown that this kind of treatment will delay the diagnosis of type 1 diabetes in those who are at risk of having type 1 diabetes down the road. So long time ago, we knew that these certain kids, certain adults will have the unfortunate diagnosis of type 1, but we unfortunately weren't able to do something about it. So luckily, and after a great effort coming from M42 and from Vineet Gupta, we were asked to look after an international patient who came to us from abroad, seeking the treatment of this groundbreaking therapy in the UAE. So the child was accommodated in our institution, and he has been provided with the most advanced treatment. His course of treatment was for 14 days, and alhamdulillah, his experience went very nice and very smooth. So we are proudly announcing that we are the first institution in the Middle East and in the United Arab Emirates to have this medication provided and delivered.
Wonderful. Thank you so much. It's very enlightening. Now, coming to Dr. Andy Ives, my favorite subspecialty of pulmonology, the respiratory diseases in children are a major burden. So if you consider 1 out of 3 children in a classroom suffers from reactive airway disease or asthma, and cystic fibrosis has come a long way from diagnosis of the gene in 70s to now medications that can control the disease in almost over 90% of the population having cystic fibrosis. What do you think, how the care has transformed and where Danatal Emirat stands in terms of holistic or multidisciplinary management of chronic pediatric respiratory diseases?
Yeah, thanks. I guess one thing I want to say that's really important is certainly in most pediatric areas, but pulmonology is my area, the weller, we know very well that the weller we keep children in their childhood kind of sets the path for their healthcare and their health for the rest of their lives. So CF's a really good example of that if they leave the pediatric service as stable and as well and as good as possible, then our adult colleagues are always really grateful to us for that, because if we send them to the adult team not good, then they stay not good, and it's often a real challenge to catch up. And there's no question that in both asthma and CF that things have changed hugely over the last 10, 20 years. If you go back when I was at medical school, which is more than 20 years ago, the life expectancy for someone with CF was probably in the kind of mid-20s, late 20s. And now a child born today with CF, we would fully expect them to live into their 50s, early to mid-50s. So that's almost doubling the age expectancy, which is a massive, massive difference. Causes problems, but of course it's a good thing. And the same is true in asthma. Things have changed hugely in my years in asthma, from treatment 20 years ago to what we do now with much more modern inhalers, much more modern medications, much better approaches. And the holistic approach, I think, is really important in that both of these aren't just physical diseases. You look at asthma, for example, look at what triggers asthma. We know there are lots of physical things, infections, exercise, allergies, things like that. But they also have a really potent psychological mental health component. We know that stress, anxiety, things like that are really potent triggers for children's asthma too. And one thing I've always been really keen on with asthma is the level above that, which is kind of education. So education for staff, for schools, for anyone else that sees children, to help them to understand how best to manage asthma. And there's something I'm going to have to say, which is kind of at the very top level as well, is that kind of what I'm really, really, really keen on as well, that if we're going to really keep children's respiratory health as good as it can be, there has to be an approach from the very top down, and I mean kind of governmental levels, because I'm very keen on the things like air pollution and the quality of what we breathe. It has a huge, huge impact on children's respiratory health. So that's something that I can't deal with individually. I can obviously work on the smaller level things, but we've got to think about this across all levels of healthcare, from the individual clinician and the parents and the child, right up to governmental and intergovernmental levels as well.
Thank you, Dr. Ives. You brought up a very, very important point of having a nationwide approach, and the institutions should be partnering with the government to kind of increase the and improve the respiratory health of children through various interventions. And thank you so much for bringing that up. Now I will turn on to Dr. Biju Hameed. So Dr. Biju is our consultant neurologist, and he is also a prominent leader in neurorehabilitation. And Dr. Biju has worked in all the pediatric clusters within M42. So Dr. Biju, I have a two-pronged question for you. One is, can you tell us about the multidisciplinary approach of care in children with chronic neurological diseases in Danatal Emirat, as well as Amana long-term care facility where you deliver care? And I also know that you are an avid supporter and believer of digitalization and innovation. and how have you integrated that within your clinical practice and service line? Thank you.
Thanks, Dr. Rizwan. Assalamu alaikum. So, pediatric neurology is a very relatively young specialty. And when we talk about pediatric neurology, we will have to also consider neurodisability and neurorehabilitation, as you rightly said. And when it comes to, the reason is like children with neurological conditions often have lots of comorbidities across the whole spectrum of cognitive, communicative, social, motor challenges. And there are several things which makes, in my opinion, M42 and its assets different to the rest of the facilities. And exactly one area where we really have achieved this is in the multidisciplinary aspect of it. And not just the multidisciplinary aspect of it, it's also aligns with M42's goals of this preventive, predictive precision care. And that's exactly what has happened or is happening in pediatric neurology. Like think of a condition like autism, for example. And I don't think like any other facility in the UAE is currently having the approach similar to ours, where we ensure this comprehensive holistic care. And when we talk about comprehensive holistic care, it's not just a buzzword. We have the physician providing the diagnostic expertise and the treatment planning, but at the same time, we incorporate a whole host of therapists who look at the social, the communicative, the cognitive, motor challenges. And what makes it even special is we have now the education and the social input as well, which provides for the family advocacy and the educational adaptations. And that's fantastic. But what makes it even more special is the digitalization. So predictive modeling for AI, which we already have, the enhanced genomic variant analysis, telemedicine, wearable technologies are all inputting into this. And this sort of comprehensive care, I don't think there is any other facility in the UAE which is geared up for it. And sometimes I even feel that even ourselves, we haven't realized what we are actually doing. And we really need to disseminate the fact that we are doing all this and really catch up and then progress further into making our assets a center of excellence for pediatric neuroscience care. I think that's what we should be aiming for. Thank you.
Thank you. I know that was your dream, and it still is, right? Pediatric neuroscience. Thank you, Dr. Biju. Dr. Vineet. Dr. Vineet was very specific in mentioning that we have to mention neonatology along with pediatrics. We cannot sideline our preemies and our neonates separately from our pediatric population. So welcome to the panel. And Dr. Vineet, can you please enlighten us about the latest advancements in the management of preterm care, especially in Danat Al Emirat, where you have a lot of high-risk pregnancies and deliveries? And how is Danat's NICU uniquely positioned to deliver this expertise of care?
Yeah, thank you so much, Dr. Rizwana, to actually listen to me and incorporate neonatology, because I'm so passionate about neonatology. So I think, if you look at the field of neonatology, it is probably one of the youngest kind of medical specialty that has come up over the last 2 decades. And also, I would always say that this is one of the most complex and delicate care in medical science, that we can provide. And in last 20 years, the way medical and neonatal advances have come up, the new therapies have come up. So we are able to even start discussing about survival of 22-weeker baby, which is a peri-viable age. So this is amazing. Now we are thinking about survival of 22-weekers. And very soon, in next 5-10 years, we'll even start talking about 20-weekers, a survival of 20-weekers with the concept of artificial womb that is coming up. So just to tell you some of the key advances that have come up. Now, if we look at extreme preterm babies, their first challenge when they are born is inability to breathe, because their lungs are not formed properly, they are quite immature, and they are not geared up to take on the gas exchange function. So these babies struggle to maintain their oxygen and carbon dioxide levels. So we have now state-of-the-art advanced ventilators that are available to us. And these ventilators are now getting integrated with AI and machine learning, which is fantastic, because what these ventilators allow us to do is not only try different modes of ventilation to cater to individual child's needs, but they are also feeding back real-time data, which gives clinicians an idea about their lung mechanics, what is happening inside the baby's lungs to which they are attached. And that really helps us tailor-made our therapies, our treatment modalities to that individual child. So we are talking about now precision medicine, which is tailor-made to one particular baby and not like generalized kind of care that we used to give in the past. Now these ventilators are so intelligent that when they are giving us the data, they are also processing the data themselves. So they are changing their ventilatory settings, the pressures they are giving, the oxygen they are giving, based on the baby's changing lung mechanics. So we are now looking forward to reducing ventilator-induced lung injuries to these preterm babies, which is one of the major cause of long-term morbidity mortality in these babies, going forward. So I think this is amazing. Now, the second challenge, once we have sorted out the breathing for these babies, is how to give them nutrition. Because these babies' gut system is completely immature. They are not able to digest milk. And if you look at all the good standard studies over the last 10 years, what I can conclude as a neonatologist is that appropriate nutrition and good weight gain is the single most important factor in survival of these babies. So how do we provide nutrition? So now we have got total parenteral nutrition that has come up. And the beauty about the latest advancement is that we can now tailor-made these parenteral nutritions based on individual babies' requirements. So every day in the morning at Danat, we look at the baby's blood results. We look at, how their vitamin levels are, how their electrolyte levels are, what exactly baby requires in terms of nutrition. And we can actually send a bespoke TPN prescription to our pharmacy. And within a couple of hours, they bring us that bespoke nutrition. And that has completely been I think, game changer for these babies and their outcomes. So now, next challenge that I always look at these babies is they are very prone to infection. They are one of the most delicate souls ever born on earth. So they are very prone to infection. Now we have got AI integrated algorithms which are able to predict the risk of any particular newborn baby to suffer with severe sepsis. So we are now we are acting more preemptively, that, okay, this baby is at much higher risk of suffering severe sepsis. So we need to be always on the guard. We need to start our IV antibiotics as soon as possible so that, the baby actually does not go through the ill effect of severe sepsis, because large number of these babies will unfortunately die if they have got severe sepsis. So, and then if we look at the kind of diagnostic modalities that have come up now recently with point-of-care ultrasonography, we have got compact machines, ultrasound machines. They are all AI integrated. So even a trainee doctor in neonatology can actually do the scan, and the machine can give us a probable diagnosis. So this has also been a game changer, because now we can actually look inside the baby's bodies, and find out what exactly is going on. There is a latest technology called as near-infrared spectroscopy that has come up in neonatology. Now, what this does is it's a non-invasive way of looking at oxygenation at a tissue level. Now, this is an amazing new technology that has come up. So we can precisely look at the oxygenation the baby's brain is receiving, oxygenation the baby's heart is receiving, or baby's gut is receiving. And this will help us to, in near future, to provide and concentrate and focus our care on, how to make sure that we can do precise interventions to prevent any complications. So neonatal world is completely changing. Now stem cell therapy is coming up. So recently there are experimental studies which are looking at using stem cells to regenerate and repair lung tissues as well as brain tissues in preterm babies. And I'm quite sure in the next 5 years we will see that actually happening in our NICU. So there are too many things which are there, and I feel very privileged to be representing Danath's NICU here in front of everyone, because we have amazing team of consultants who have trained abroad in different countries, who have come in with lots of experience in all these newer technology. And we have a fantastic infrastructure at Danath, with latest ventilators. We have got AI integrated ventilators. We have got fantastic pharmacy support to give bespoke TPN. So yeah, I think Danath is very much well poised to give the best possible care to these extreme preterm babies.
Thank you, Dr. Vineet, for this comprehensive description of services, neonatal services available at Danath. And each one of my colleagues here has beautifully described how Danath Al Emirat is not only a leading center in treatment of pediatrics, but also center of excellence for pediatric subspecialty services to deliver evidence-based, quality-driven, safer care for our kids and neonates. Because of time constraints, I would like to open up the questions for the audience. If anybody would like to ask any question from the audience. No, we have 1 hour 45 minutes, so like Dr. Abdulla, if you want to summarize Danath's efforts not only in delivering clinical excellence, but also being part of a journey of innovation, digitalization, research, and education.
Absolutely. It has been well mentioned by all my colleagues, using the most advanced technology, the evidence-based medicine to deliver the best quality of care in general pediatric and other subspecialties. On the other hand, we are working as a teaching hospital, so that's basically giving us more accreditation toward increasing our knowledge and experience. And parallel to that, research is something that we are keen to take it even further. And all of this, if you put it together, will make sure that we deliver the best quality of care to our kids. Yeah.
Thank you so much. Dr. Andy, would you like to add something from the pediatric pulmonary side of care in terms you mentioned about education, not only of the trainees, but also of the staff, to be able to deliver safe, precise, and quality-driven care?
I guess the thing I want to say thanks for my colleagues mostly is pharmacy have been brilliant, allowing me to get all from an asthma point of view, I've constantly gone to them, say, can we get this inhaler? Can we make sure we've got all these inhalers? And they've been absolutely fantastic at that, because it has absolutely allowed me to give children with asthma the best care that we can, that follow all the modern up-to-date guidelines.
Thank you. And Dr. Biju, I will like to have the last word with you about specifically for your subspecialty about transition of care from adolescents and older children to the adult practice, and is Danath prepared for it, or what are the steps you are taking to ensure that and enable that?
No, absolutely. The beauty of the multidisciplinary care, in fact, it is perhaps not right to talk about multidisciplinary care anymore, because multidisciplinary care has transitioned to interdisciplinary to now what we call as transdisciplinary, because all disciplines, they do not have traditional lines of expertise. They all come together and chip in their bit, and the decision making is very decentralized. And one of the key things in terms of the transdisciplinary care is also looking at across the lifespan. So particularly with the conditions which are like neurological conditions inherently have this long-term morbidities. And one of the key things, as you rightly pointed out, is the transition of care. And currently with our transdisciplinary setup, it is very well geared towards that, particularly from the education. And perhaps now that we have also moved into tertiary care for adults, perhaps that would be a good way of linking the primary to secondary to tertiary, and then to go onwards for transition care to make sure that the care continues. Thank you.
Thank you so much. It was a wonderful session, and you guys have been a wonderful audience. Thank you, gentlemen, for your time, and thank you all.